Okay.
Welcome everybody to day 2 of the January Nevada State Independent Living Council. Thank you for joining. Ron, is the posting verified?
The posting is verified. Thank you.
Wendy, can you take her off, please?
Yes, I can. Dawn, can you watch the waiting room for me?
Yes, I can.
Thank you. Okay, Havander Davis. Vicky Essner.
Present.
Mary Evilsizer.
Present.
Dee Dee Formaster. Jennifer Kane.
I'm here.
Sabra McWhirter. I saw her. Raquel O'Neill.
Here.
Obioma Officer.
Here.
Kate Osty. Cheyenne Pasquale. Renee Portnell.
Present.
Ace Patrick.
Present.
Linda Voivoda. And Julie Weissman Steinbach.
Present.
And we do have quorum.
Again, thank you, Wendy.
You're very welcome.
So we're gonna start with item 9, and then we're gonna go back to Sydney when we complete that. So I'd like to invite Kim Adams from the Division of Healthcare, Financing and Policy to give her presentation.
Perfect. Thank you. This is Kim Adams. I am going to go ahead and share my screen if that's okay, just so that
Yes.
we can all look at the report together. And let me go ahead and get my notes open really quickly. Okay, so thanks for inviting me to join today. My name is Kim Adams. I'm the manager over the Rate Analysis and Development Unit with Nevada Medicaid. And I was asked to come speak today about our quadrennial rate review process. So to begin, I thought it might be helpful just to give a brief overview of what the project is for anybody who may be unfamiliar, and explain our process a little bit in terms of what we look at, and then I'll go over specifics of the latest report that we published. So the quadrennial rate review is mandated under Nevada Revised Statute 422.2704, which states that beginning in January of 2018 and every 4 years thereafter, the Division of Healthcare Financing and Policy must review the rate of reimbursement for each service or item that's covered by Nevada Medicaid to determine whether our reimbursement rates accurately reflect the actual cost of providing that service or item. And so in the process of doing that analysis, if we determine that the rate of reimbursement does not cover the actual cost of providing the service, then we recommend to the director's office the rate that does cover the cost of providing that service. So what the quadrennial rate review does is it compares our fee-for-service reimbursement rates to providers' reported costs. And then we also look at a few other areas just as additional points of context. So we look at Medicare rates, we look at a handful of what other states pay for those services, and then also analyze 5, 10, and 15% increases for each provider type. We do rely heavily on provider feedback and accurate cost reporting to be able to complete this project. And without the feedback from Nevada Medicaid providers, we're not able to make a recommendation on how to amend the rate. So we do include those other data points just in case we don't have any responses, but we're not able to make a recommendation based off of those. So our process for the quadrennial rate reviews is we publish surveys online annually. We have a 4-year schedule that breaks out all the provider types over the course of 4 years and make sure that everybody is surveyed at least once every 4 years. Because the statute is written in a way that asks us to look at everything at a code or service level, the surveys are set up in a way that aligns with the billing practices for that provider type. So if, for example, the provider type is paid off of a fee schedule, that fee schedule is the template that we use as the format for the survey. We make notice of survey availability quite a few different ways. We send out email and fax blasts to providers who are enrolled under each of the provider types being surveyed. We reach out to any provider associations that we're aware of. We post web announcements. We do social media posts. We talk at meetings like this. So we're really trying to get the word out there as much as we can. Once the survey period closes, we begin working on analyzing the data. Provider responses are used to determine the median cost of providing each service or item, which is then compared to the rate. We use median rather than the average cost, just because with averages, you have outliers that can skew the cost in either direction. So if we got one response that was really low for a specific item or service, it would kind of bring down the average. So the median kind of takes care of that and makes sure that we're looking at kind of that middle range a little bit better. And then we compare that to the current reimbursement rates, and then the aggregated data is compiled into an annual report, which is sent to the Director's Office for Health and Human Services, and then also published on our website. The annual report is typically published the calendar year following when surveys were issued. So we did just publish a report back in 2022. Over to that. Are you able to see my screen?
Yes.
Okay, perfect. So this was a very large report. We were playing a little bit of catch up with this one. So all of these provider types that are included on this list, some of them were surveyed in 2021, some were surveyed a little bit earlier than that. So we're trying to get caught up with our first survey period. And then we're hoping to be able to kind of distribute the surveys a little more evenly across a 4-year period. So there's quite a few provider types that were included in this report. We do have home health on this one, as well as many of our 1915 services and waivers. So, waivers for individuals with intellectual disabilities, adult day health care, day and residential habilitation, the physically disabled waiver, assisted living waiver. So quite a few provider types were included on this report. This next section of the report here is provider types where we had at least a 10% or greater response rate. So like I said, we're trying to get the word out as many ways as we can. The response rates have been a little bit lower than we would like them to be. So if there's any suggestions on better ways to reach out to providers and increase engagement, we are always open to ideas, because I have told people I would love nothing more than to just be buried with survey responses. So always open to ideas there. And this next list here, it's a little confusing because so we have some of the provider types that we didn't receive any responses back from providers on. And so for those provider types, we can't make a recommendation to change the rate. The QRR statute is pretty narrow in scope. And it says that if we find that the costs don't align with the rate, we can make a recommendation. So if there's no responses, we can't really comment one way or another on amending the rates. And then there's also providers on this list who we did receive survey responses for, but the aggregate impact of aligning the rates with costs was a negative number. And I'll kind of expand on that a little more later. We are amending this section of the report a little bit in our 2023 report. So I think it'll be a little bit easier to understand and kind of see that when we do receive responses back, if there are some codes that the reimbursement rate may exceed the cost of providing the service, we're still acknowledging that there may be other codes on the fee schedule where the reimbursement rate doesn't meet the cost of providing the service. So the next part of the report just gives a little bit of background on what the project is, and then our approach of how we go about completing the report. So I'm going to kind of skip through that a little bit. Just includes all these different provider types that we surveyed. And then there are some provider types that we don't actually issue surveys for, and it kind of the reasoning for that varies a little bit. So for example, this first provider type on here, 16, which are the publicly owned intermediate care facilities. So I think Desert Regional Center is the only provider we have enrolled in that category. Their reimbursement methodology sets their rate at 100% of cost already. So it would be kind of a moot point to survey them to find out that we pay at 100% of cost already. It would just be a net zero impact essentially on the report. So there are a handful that we don't actually survey, but we kind of memorialize in the report explaining why surveys weren't actually sent out for those provider types. Next section goes over the methodology in a little more detail and explains, the other states that we look at. It's typically Arizona, Colorado, New Mexico, Oregon, and Utah. We look at those states because they have a similar population makeup as Nevada. So there may be a few urban areas, but there's also large parts of the state that are very rural. So we typically don't look at states, like California or New York, because they have a much higher cost of living. It's a lot more urban than Nevada is. So we try to look at states where that are most similar to Nevada. Sorry for the scrolling. Okay, so this first table here explains the response rate by provider type. So you can see it'll say how many providers are enrolled under each provider type as of the day that the surveys were issued, how many codes are on the fee schedules, how many responses we received, and then what that response rate is overall. So you can kind of see that for some provider types, we had a better response rate, like this 20% here for adult day healthcare. Other provider types, we have very few responses, so we don't have a lot of data on those. Sorry again for the scroll. Okay, so table 2 here is the impact by provider type and specialty. And I did want to draw attention here to home health, for example, under provider type 29. So what this table is showing for most provider types is if we were to change all Medicaid rates to align with the costs that the providers reported on the survey, this is the difference between what we pay now and what we would pay if we aligned all the rates with cost. So I went back and looked at provider type 29 as an example. And on that survey, we had quite a few codes that we didn't receive any data for. And then I believe there were about 5 codes that showed that the reimbursement rate did not cover the cost of providing the service. And I think about 5 or 6 codes were based on the survey responses. The current reimbursement rate may exceed the cost of providing the service. What happens, and why I think this is a little confusing, is we take that difference per code and multiply it by the utilization of each service. So if I have 2 codes on a fee schedule, one would need to go up by $1 to meet cost, and one may need to go down by $1 to meet cost. If the code that needs to go down by $1 has higher utilization, so there were more units of it billed in the base year, it's going to result in this aggregate calculation here of a negative number in there. And so I think it's a little misleading. And so the changes to the report, there'll be an additional table in the next report that shows for each provider type, there's this many codes on the fee schedule. We receive data for, 50% or however many codes. And then it'll actually say, 5 codes needed to go up, 5 codes needed to go down, just so there's a little more transparency in the results. There's some caveats here that are explained, just, stating the statute for the quadrennial rate review doesn't give us the authority to audit any of the provider responses that we get back. So occasionally we'll respond back to providers if we have questions, but we don't have the capability to, pull their cost information over and validate the results that they're sending over to us. We also we don't have access to what the managed care plans pay for the services that are covered by managed care. That's usually considered proprietary. So we're just using the fee for service rates. Then the last section of the report will go over the recommendations. So these are the provider types that we recommended for an increase in this report. These are shared with the director's office, but the rate analysis and development unit at Medicaid doesn't have the ability to implement any rate changes that we recommend in this report without approval by the director's office. And it does note in this section that some rates would go up, some rates would go down. And this last table that's in the report shows the other scenarios that I mentioned. So it'll show how much we spend on that provider type now as the base year, how much more or less we would spend if we matched the cost of providing the service as reported by the providers, if we matched what other states pay, Medicare rates, and then those 5, 10, and 15% increases. And then at the very end of the report, it goes over some more, sorry for the scrolling. It goes over some more specifics for each provider type and explaining the average percent change per code, the fiscal impact over the 2-year period, and then what the non-federal or the state share of increasing or decreasing those rates would be. So we are working on getting the report for 2023 published online. We're hoping to have that available sometime early in calendar year 2023. I don't have an exact date on that just yet. My staff are working fast and furious to try to get that out as quickly as possible, but some of the provider types in the 2023 report have very large fee schedules. So for example, provider type 20, I want to say has several thousand codes on it. And so it does take, quite a bit of time to capture all that information. We will also be posting new surveys online in a few months, probably late spring or early summer. We still need to finalize our list of what provider types will be surveyed during that time. There will be some provider types that we have to include in this survey round because they were last surveyed 4 years ago and they have to be included now to make sure that we're hitting that 4-year mark. But we may shift some provider types around, if there's a need and indicated by our policy staff that they should be surveyed sooner, or just to more evenly distribute those so that we have them a little bit more spread out over that 4-year period. We are always looking for suggestions on how to improve the process for everybody involved. If there's better ways to reach out to providers, if they need information on how they might go about calculating their costs of providing a service. We did do a public workshop a few years ago. I want to say it was in 2020. And that presentation included some resources on how providers might calculate the cost of providing the service. So we do have a recording of that public workshop posted on our website. And then the PowerPoint that's along with it has some links to resources that providers can use to look into how they might calculate the cost of providing those services. And that is the end of what I had prepared. So I am happy to take any questions, comments.
Thank you so much.
Would you mind? Oh, thank you.
Ace, you had a question?
Yeah, hi, this is Ace Patrick. So I have 2 questions. In your recommendations for rate increases, are you recommending at all that the rate for reimbursement for fuel for travel be increased from 22 cents to reflect, I guess, what's happening with gas prices and travel? And the second part of that is, are you recommending a rate of increase for PCA services for those of us that are on Medicaid that receive PCA benefits? Many of us have lost our PCAs because Medicaid is not paying enough, and we're on wait lists because private insurance has taken up most of our PCA services. I'm one of those. So those are the 2 questions, because also that reimbursement for fuel also impacts any of our PCAs, as well as just general being paid something to reflect what's happening in our economy right now. Is that clear? Are you recommending those things?
So I don't believe that PCS was included on the 2022 report. I think it may have been on a prior report. Let me double check that very quickly here. And I can put the link to where all of the reports that we've published so far are available. This is the 2022 report was our third report we published. I thought I saw PCS on a prior one. Let me look. Okay, so provider types 30 and 83. So provider type 30 is personal care aid, provider agency, and then provider type 83 is personal care aid, intermediary service organization. Were included on our 2021 report. Let me see if they were recommended for an increase. So yes, it looks like we recommended an increase for both provider type 30 and provider type 83 on that 2021 report. The Medicaid budget, the agency request as submitted for this next legislative session is public information. I believe there are rate increases built into our budget for next biennium for personal care services. I don't know that mileage was included in the calculations that we did on that one, or if it was just the personal care service itself, but there is a request that we have in our budget to increase those rates. It does still have to go through the legislative process and get approved for us to be able to implement that rate increase, but we did include that in our budget. In terms of mileage, I would have to check back on that. I'm not sure how often we update those mileage rates. With any projects like this, there's always a little bit of a lag, which is kind of unfortunate. So we're publishing the results, usually about a year after we do the surveys. And lately, obviously, we've all seen there's been this huge rise in inflation. And so we're always kind of operating on a little bit of a lag there. But I can look into that mileage and see if there's any proposed changes for that one. I'm just not sure off the top of my head.
This is Ace again. Okay, thank you very much. I'd be real curious as to hear, what the proposed increase in rate for PCA services will be, and the mileage as well, because that impacts many, many people who are being reimbursed for mileage. So, okay, thank you very much. I'm still at it, but wondering how much that hike will be, and whether or not we'll get our PCAs back.
Yeah, and when we submit something like that in our budget, there's usually an amount that, let's say, I don't remember what the increase is for PCS off the top of my head, but let's say it's 10%, like we put in for a 10% increase. The legislature kind of they can do with that what they want. They could say, no, we're only doing 5, or they could say, no, that's not enough, let's do 20. So it's kind of, we'll find out through the next couple months what they decide to do. So just because it's in our budget one way initially doesn't mean that it may not transform throughout the legislative process.
So, did you have a question?
Yeah, thanks very much. I guess a lot of us will have to show up for those legislative meetings and give our personal testimony, and hopefully they'll hear us. Thank you very much. Sorry, Julie, I didn't mean to speak over you. Just
No,
once.
that's
Thank you, Julie. This is Dawn Lyons. I guess I'm a little confused, and I kind of missed most of that presentation from distractions in the background because I'm hosting the meeting, but it didn't seem to match the report that I had received, and I was trying to open it on my end so I could share what I wanted to show you, but it won't open on my end for some reason, technical issues. So I'm left to my memory, and what my memory tells me is that it said that there were no recommended increases for PCAs on this current report. And I don't know if you covered that and I missed it, or if if you just didn't cover that portion of it, or if it was a different report. But my concern wasn't so much that that the recommendation wasn't there currently. as much as what the data points of what you consider similar states to be, and how you determine, what you're comparing against. Because we have here in Nevada, we have PCAs that have to pay for their own education and continuing education trainings, and we have overhead costs for providers that don't allow them to pay the actual service care workers as much necessarily as maybe those other states do. And there might be a difference in that, is what I'm saying. I don't know if you're just looking at provider rates for Medicaid, because that could be vastly different from one state to another if there's a lot of overhead costs for providers involved in one state as opposed to another. And so those kinds of details are important to know. And I just don't know if, because it's not in the report and it doesn't explain those details, I don't know what to make of it, of the data. Does that make sense?
Yeah, it does. And I think you're on the right track. So the staff that we have working on this project, we have 2 people and they're doing all of these provider types. So they do reach out to the subject matter experts that are over the reimbursement methodology for each provider type to get their input. But I think getting down to kind of the granular level that you're looking at in terms of, what are the provider qualifications out of state? Is minimum wage the same? Are the training requirements the same? Continued education, things like that. We don't get quite into that level of detail. And so we don't use the out-of-state rates to guide recommendations. The recommendations that we make to the director's office are solely based on the provider's reported costs. That statute, it just says if we determine the cost of providing the service is not covered by the reimbursement rate, then that's what we would make a recommendation on. We did start including the Medicare rates and what other states pay, just because we had pretty low response rates at first. And so there wouldn't be much, the first few rounds of surveys we did, there wouldn't have been a lot to report on without having some of those other data points. So I think we're kind of seeing more survey responses come in, but I would love to have more. And just to clarify, when you're talking PCA, are we talking personal care services? I just want to make sure I'm not misunderstanding.
Yes, personal care. I know PCS is the Medicaid term.
Okay.
Sorry.
I just wanna make sure I'm not giving you the wrong information. So that one was included on the 2021 report. And I have it.
You said, but in the 2021 report, you said there were, I did see that there were recommended increases. However, in the last report that I got, it didn't recommend any increases for that particular sector.
Okay, so, and we don't survey every provider type every year. So we have, I think like 60 or 70 provider types. And so they're usually only going to be surveyed once every 4 years. So if we surveyed PCS in 2023, they likely wouldn't be surveyed again until 2027. And so maybe that's the point of confusion there, is we're not looking at every provider type every year.
So this is Dawn Lyons. That brings me to my other concern in that your low response rate to these surveys. I don't know what you're doing to improve the response, but my thought was, because those numbers were so incredibly low, you couldn't get any significant data out of it. Like, you would really have to redo it in order to get any kind of better response to get anything significant out of it. And I would think that significance would matter, mathematically speaking, of course.
Yeah, and that's a great recommendation, is to maybe we start out with the provider types that we didn't have great response rates on when we're looking at reformatting those schedules. So there will be certain provider types that we've surveyed, if we surveyed them back in 2019, we would need to survey them again this year, because it's been 4 years, so that we can make sure we're complying with the statute. But I do really like that recommendation of looking at provider types with low response rates first and kind of giving them an opportunity to complete it. So normally when we post the surveys, we'll do an initial web announcement. And we've tried to format that web announcement to be attention grabbing. So I've asked that our fiscal agent list the provider types in there if they'll fit. Sometimes we have a character limit and can't quite get everything in there, but saying, provider type 83, that way, if they're going out and looking at the web announcements, it's hopefully drawing their attention to that. There's initially we were just doing the one web announcement at the beginning of the survey period. We started doing a reminder web announcement as well, usually about a month or so before the surveys are due. Just so if people saw it initially and then maybe put it on the back burner because they didn't have time to do it right then they have a reminder that it's out there. The email and fax blasts that go out are targeted to each provider type. So if we're surveying provider type 20, every provider type 20 should get an email or a fax blast saying, hey, we're doing a survey, please, here's the link to our website. Please go out and complete this for us. I think I emailed like 15 provider associations in the surveys that we did in 2022. But we're always looking for new ideas on how to better connect with providers, how to get more people to respond, so that we do have better results.
So I'm just wondering, I know Mary has her hand up too, and I want to let other people ask their questions, but I'm wondering out of curiosity if you've looked into the potential reasons behind the lack of response, meaning are they going straight to their junk mail and they don't even know that they're getting them? Have you researched those kinds of things to find out how you could improve your response rate?
One thing that we are aware of, and it's not unfortunately something that we can really fix on our end, is those email blasts go out to whatever contact point they have in the provider portal. And so if a provider enrolled, let's say 5 or 6 years ago, and the credentialing person who handled that is no longer with that organization and they didn't update their contact information in our provider portal, it'll still go to that old email address. But that's something that has to be updated on the provider side. So we've tried to encourage providers, to make sure that they're keeping their contact information up to date as much as possible, so they're getting those notifications. We had identified a few years back that, maybe we're just asking something that providers don't know how to provide, give us information for. Some larger organizations are probably used to reporting on costs and being able to drill down to what is it, for a dentist, for example, what does it cost you to do a dental cleaning? But a smaller organization may struggle with that a little bit because they don't have familiarity with capturing costs in that way or factoring in all those additional things. So, yes, what do you need to pay the staff person rendering that service, but what are your overhead costs? What are your supply costs? What is it, your medical billers and your receptionists and everything like that built into it? So that's why we did that public workshop a few years ago, is to be able to provide some of those resources and, really explain to people different things you may look at when you're calculating the cost of providing a service. And so if we may want to look at doing another public workshop similar to that, just to, see if there's any questions or any barriers that are causing people not to respond, or if there's something else going on.
Mary?
Thank you, Julie. Welcome, Kim. I have 2 questions, and let me see. One of my questions is, you did mention that you don't survey managed care, you only survey fee for service. And with a lot of the Medicaid, individuals are allowed to select a prescriber like United Health or Silver Spurs, or so is there a reason that the managed healthcare aren't included in the surveys, and why just fee for service?
So I'm sorry if I wasn't clear. We do survey so in order to enroll with one of the managed care plans, you have to enroll with fee for service first. So any provider that is providing services under a managed care entity would have to be enrolled on the fee for service side. So they still should be getting those notifications. What we can't do is we can't compare what the managed care plans pay for individual services because we don't have access to those rates. So at a baseline, I believe if we pay, let's say $100 for a service, I believe the managed care plans have to pay at least $100 for that same service, but they have flexibility to negotiate higher rates with the providers that they work with. So we are looking at managed care utilization, and the managed care providers should still be getting notification that these surveys are available because they'd have to be enrolled on the fee for service side too.
Okay, thank you for clarifying that. It seems like the managed care would be very interested in participating in your survey because that serves them well as long as providing you with clear data. That's question number one. And question number two, I don't believe I saw on your recommended list because you had the line item home health care, and there seemed to be a much lower amount in the amount spent than the amount was reported by the companies that were surveyed that they were paying out. Is that correct? Because there seemed to be a disparity, but I don't think I saw home health care in the recommendations for an increase.
Yeah, and that's something that I will be correcting going forward on future reports. I think it's a little misleading in that section because the aggregate impact is a negative number, so it doesn't look like it needs a rate increase. But when I look at the detail for home health, there's, I think, about 5 or 6 codes that do show the need for an increase. And so the files that we use to do this analysis are massive. Like for each provider type, each Excel file has, I think, over 20 tabs on it. And so it's just a ton of information to put out there, and it would be hard for general public to kind of interpret. So that's why we aggregate it in the report. But all that detailed information is available to the director's office if they need to see the impact on a code level. And that's why I want to make that change to the report. So it's a little more understandable, I think, to say, okay, so there's 20 codes on this fee schedule. We didn't get any responses on these 10 codes, but these 5, are showing that we need to increase the rates for these services. And then these 5, maybe the reimbursement rate exceeds the cost of providing the service. We wouldn't go so far as to recommend a decrease necessarily. That's outside the scope of the statute, but we want to make sure that we're identifying, even though the overall impact is a negative number, there are still codes that exist on this fee schedule that do need a rate increase. So that'll be a change we make going forward to make sure that we're taking that into consideration and that it's clear on the report too.
Okay, thank you. We appreciate that. And then right now, home health care is vital to our community as well as the PCA services, as Ace mentioned. And then a lot of people are leaving the field, and one of the few ways that employers have to both obtain and retain employees is to increase the rates to be competitive with the market. And I just want to chime in on the mileage rate that personal care attendants are receiving. Right now, the mileage rate for the federal and the state just went up to over 65 cents per mile. And if PCAs are receiving 22 cents, that's, Ace made a very good point that there's a real disparity between what is being paid to some of the people that we value. It's the life sustenance for some of our consumers. And that's something that really needs to be looked at, because you can increase the salary, but if they're spending all their money on mileage, or when the pandemic first started, they were also buying their own gloves and masks. So these people are working and trying to provide services, but they need our support as a community. So thank you very much, Kim. You're doing wonderful with your reports. What a mind. Thank you.
Thank you.
Dawn, did you have a quick question?
I did. Thank you. This is Dawn Lyons. Just one more, I guess it's more of a comment than a question, but I'm thinking that if they're every 4 years and we have this, 3-year pandemic in the middle of all of that, and our economy has drastically changed over those few years, that I just don't feel like that's often enough. Or, not only is it not often enough, but it's just not often enough, like I said, when you don't have the response rate that you should. And that's really something I appreciate you saying you're going to take a look at, because that's very concerning for people with disabilities who don't want to be institutionalized and rely on that PCS service. That's very concerning. So I appreciate you giving us that report today. And I appreciate you being here and letting us know all the details. And it's important for us to understand those things. So thank you.
Yes, thank you, Kim.
Yeah, you're welcome. And if there's any other, like if, meeting wraps up and you have another question or concern later, please feel free to reach out to me. Or we have like a devoted mailbox to the quadrennial rate review. It's just qrr@dhcfp.nv.gov. And I do agree that Medicaid typically does run on a little bit of a lag. Unfortunately, it's unavoidable in some aspects. We have some provider types, like our critical access hospitals, that we use their cost reports to set their rates, and they're usually on about a 2-year, if not a little bit longer lag. So it's really hard to have that, most current information. And then typically we need to wait for a legislative session to implement any rate changes because we need that authority to change what we're spending. And so we're kind of constantly playing catch up. But when we issue the next round of surveys, I'm not entirely sure what provider types will be on there just yet, but if there are any that have any crossover with this group, I'm happy to share those so that you can share with your members and really help us get the word out there to complete those surveys. Because like I said, I would love to have thousands of surveys in our inbox and have a really robust response. So anything you can do to help, or any other ideas or suggestions or concerns, please send them my way.
Great. Thank you. Thank you so much, Kim. Okay, so we're going to backtrack a little bit from yesterday. And I'd like to invite Cindy to lead a discussion about the Olmsted study.
Thank you. And I'm unmuted and I have a microphone, and I'm assuming folks can hear me today.
Very clearly.
Thank you.
Thank you.
And you can't see me because I've got my my copy of the document that I wanted to talk about. So I'm going to try very hard to keep this really short, because what I could do is read everything that the ASDS has given us as far as its Olmsted planning process. But thanks to Dawn and Wendy, I sent several documents, and those were forwarded to this council, basically on the agenda of the steering committee, the different kind of formats they're going to use, the phases that they're talking about. So now we are in phase 2, which is basically looking at gaps in services. And then they're going to be gathering more information. And sometime in October, they hope to have the plan ready to go. What I think is very important for this group is knowledge of the Olmsted. To me, I've been watching this since 1999, and the Olmsted decision started out with simply housing to women in Georgia. And now if you follow the Department of Justice, it has gone way past housing. It is involved in expenditures, how we spend our money, how we support people in education, how we support people in employment. And Dawn said something a couple of seconds ago that just kind of rang into me, that without these things, many of us are at risk for institutionalization. And I think that, to me, that's the essence of what Olmsted is all about, for us to create a plan that we don't allow that to happen, that the gaps are there that don't let it happen. And in the documentation that I gave you, it lists the things that it has to do, the plan has to do. It has to have concrete results. It cannot just have kind of vague assurances. It has to have dates. It has to have time of when these things are going to happen. And it has to have money attached to it. Those are very important parts of what the SDSS has listed for us all to look at. Very important for this group. The SDSS has created a website, and it is on one of the documents that I had sent to you. It's called Fact Sheet. It's on the top, the website. And being an Olmsted nerd like I am, I would be following that on a weekly basis or bi-weekly basis, whatever, because at the meeting that we had, the initial meeting we had, and then at the so-called study session that was held on January 4th, they did a nice job of outlining what they're going to do. They also talked about their threats to success, why the previous Olmsted plan was not successful. And I think this is very important because what they learned in the previous Olmsted plan, which I think 2016, the document came out in 2017. So here we are 2023, and we're still kind of meandering about on this. One thing that the document said why it was not successful, and I might not be using the words that they use, but that's basically it, is because in the plan in the mid 2010s, there were points to make happen, but we're out of ASDS's purview. So let's say vocational education, that sort of thing. So basically what they're saying is, gee, now we know better. We're just going to do what we can do. So at the steering committee, at the whatever study session in January 4th, 3 of us asked, well, and I asked at the very beginning, if we're going to do this, if we're going to spend all this energy on this plan, and I'm speaking to you as an advocate, not as a bureaucrat or a politician, and a person with a disability, why are we not capturing this moment to bring in those other organizations? Again, Medicaid, do we all know what one another's doing? Do we all know what voc rehab is dealing with? Do we know what education is doing? So we could put together a nice, well-braided plan. And they answered my question, and 2 other people asked pretty much the same thing. And I'm really, I can't tell you what their answer is. I don't know. Somebody did ask, have you thought about inviting a legislator to the committee? And of course, this needs legislative, if it's going to need money, it would seem to me that the people who hold the purse strings, they would be good to have there. And of course, the people on the committee said, yeah, that's a great idea. So it's, I am offering you my my very subjective opinions that I think that this is a missed opportunity by this group by not requiring or inviting those people in. And so when those other things fall off a year from now, we're going to say, well, gee, what did we do? Oh my goodness, we should have brought those people in, those organizations in. So you all have the documents, the one document that has the website. It is important to know that they are going to plan 8 workshops, 4 in the rural parts of the state, and 2 in North and 2 in the South. So anybody that's interested in what many consider to be the most significant civil rights ruling in this country, they I would truly kind of keep attached to that. So again, I'm kind of one of the nerds that loves to talk about the stuff, but I know you've got other things to talk about. But that's basically what I'd like to say. Again, look at those documents, look at what's happened in the past from the previous Olmsted plans in the late to mid, early to mid 2010s. If you have any questions, I probably won't be able to answer them because I'm not writing it, but you could send it to me via email and I'll see what I can do to find out. But I'm happy to entertain any questions anyway. Thank you. Thank you all for listening to my muffled voice yesterday and to hearing me today. Thank you.
Thank you so much, Cindy.
Thank you.
Dawn?
Thank you. This is Dawn Lyons. Cindy, thank you for giving us all that information about the steering committee and that last meeting that was held. And if I recall right, that last meeting that was held, the the question was asked, I asked the question even, what if the Division of Public and Behavioral Health invited all parties in, how come it wasn't done properly at that time?
Yes.
And of course, no one was there from the Division of Public and Behavioral Health to answer that. But Aging and Disability Services said, well, that's why we're doing our part now. And I think that both parties who planned this Olmsted plan dropped the ball big time. I mean, it started with the first one where they had the opportunity to really make an impact, but they were reactionary based on their own issues within their division. And so now we're given this other opportunity to do it right, and they're using the excuse that it was already done. So I feel like, everybody's kind of passing the buck and deciding to do their own thing. But I do think that it's better than nothing. and I think that we do have an opportunity here to impact Aging and Disability Services plan, whatever that looks like, which I've been assured that, actually Lisa from SCE, Social Entrepreneurs, who is contracted to do the Olmsted Plan report itself and to collect the data, the organizers of this anyway, she was here to answer questions. And Cindy, I apologize that it didn't line up with your with your presentation, because I think that would have been amazing to have that as a resource at this time. But she did answer some questions for us yesterday. And one of the things that she said was that, or at least Cheyenne said, was that this plan moving forward is, we're hoping that it would not only be a tool for advocacy bodies and advisory bodies within Aging and Disability Services, but also that it would be an improvement of Aging and Disability Services regarding Olmsted decisions, so that they could steer everything in a better direction. And so being assured that that's the direction they were going in with this yesterday, one of those things that, because when they said it would be a tool for boards and commissions or for advisory and bodies, I thought, first thing I thought was, what does that mean? Like, oh, we have to do all the work again? Like, you're just going to lay it in our lap, but no, when I inquired further, it was recommended that we could get some data out of it, some real data on people with disabilities in Nevada. And I thought, well, that would be a great tool, so if we can go in those directions, but the thing is we all need to speak up and make sure that those things happen. And we can't rely on just a steering committee to make it go in that direction. Although I know you're going to do a great job with that, Cindy and Julie, you both being on that steering committee. But the public, people with disabilities, people in our community need to go to these public town halls and express themselves and explain these things to the entities and the agencies that probably just don't get it. So
Yes.
Thank you.
Well, thank you for your very hopeful tone. I will tuck myself into bed tonight with that hopeful tone, because I'm a little bit less hopeful, but people like Julie and I will keep moving forward. Thank you so much for all your good work, everybody.
Larry, did you have a question?
I did. Thank you, Julie. And Cindy, thank you for your good work. You are going to do wonderful at this. I have a question, Cindy. You mentioned that Voc Rehab is not there. Department of Education is not there. I don't know if it's too late, but I'd be happy to reach out to the director of Voc Rehab to see what role they could play in this, because they are going to be a vital component for at least one section. So if you'd like, I could do that. And then maybe if he assigns a VR counselor, then connect them with you and you could mentor them into the process. Would that work?
I'm not sure if a member on the steering committee has that much
Power.
power.
Yes,
Okay.
that's what I was gonna.
Do you agree, Julie?
Yeah,
Yeah.
it's, in a
Okay.
way, it feels pretty rigged. I hate to say that, but it feels pretty rigged because they control who's on and who's not.
I agree with Julie.
I understand.
Yes.
I will mention this.
Jennifer,
The other question, Cindy, is there are 8 workshops that you mentioned yesterday and today. Do we have the dates and locations scheduled? for
not yet.
Yeah, they haven't given them to us yet. They might give it to you the night before.
Oh,
That's my cynicism. I don't know when they're gonna come out. And you know what? I could get in touch with Cheyenne and ask her when they're coming, or the other lady that's the facilitator for this, because I think these things should be on people's calendars. For one thing, not just for your own person, but so that you could let your constituency know about
Yeah.
this.
Exactly. When they're out, we're happy to. And I was talking to our sister center, Lisa Bonney up north, and we're happy to help you with social media, with Facebook. We're trying to get our consumers there as well. So when those are out, I'm sure the SILC will get them to us. But in the meantime, thank you. Thank you, our ADA nerd. We do appreciate you.
Thank you.
Jennifer, and then Ace.
I'm so sorry. I'm having a delay when I try to come off mute. I don't know exactly what's happening, but it eventually came off. I just wanted to thank those of you that are on the steering committee for pointing out that education in VR had not been invited to be part of that. That speaks volumes, I think, in many ways. And I want you to know that when you did inform us that that meeting was happening, I RSVP'd and attended, as did the assistant director for the Office of Inclusive Education at the Nevada Department of Education. We also shared the information with vocational rehabilitation. I work most closely with Michelle Merrill, but also with multiple other people on their team, as we have just spent the last few months reworking our formal interagency agreement between our 2 institutions. So we've been meeting like almost weekly since August. And so I want to thank all of you for recognizing the fact that that was the case, and for making sure when there were junctures to bring us in that you did that. And just, let you know that I thought it was very interesting, because we had results that were shared where it very clearly said that the word hadn't gotten out and people didn't know about Olmsted. And it's like, well, one of your greatest sources to get that kind of information out through anybody, at least in the school system, would be the Department of Ed, right? And our local education agencies, our school district partners as well. So thank you for including us. We are here. We are happy to be part. And we hope as they move forward that will be recognized by everyone. Thanks.
Thank you so much, Jennifer. Ace.
Hi, this is Ace Patrick. Just my 2 cents worth to Cindy and Julie. When these workshops happen, I'm really hoping that they're either online or that they're hybrid and not just in person. I know there are people across the country who've been complaining that all of a sudden now everything is happening in person again, and that eliminates a lot of us that are not going to in-person events due to reasons like COVID still. So my 2 cents worth is I'm hoping that they will be either virtual or that they will be hybrid and not just in person.
That's a good,
Yes.
could you text me that so I don't forget to raise that as an issue?
Yeah, thanks. Because I mean, it would eliminate a lot of us who definitely want to have input, give input, and yet aren't able to, So
Yeah.
thanks very much. Thank you both for doing this service. I mean, I'm really happy to hear you're both there.
Thank you.
Thank you for raising that issue.
Yes.
Renee.
I wanted to state what Ace had said about some of us not being able to physically get out of the house or go to such meetings. I went to, I think it was the last steering meeting and listened by Zoom and got information. I didn't have a lot to say because I wanted the information before I said anything, but hopefully the next steering committee you guys go to, I can get the email of when and go and just learn about it. Because that's what I crave for.
Renee,
Each step.
we've got a lot of distortion behind your voice. There's wind or something in your microphone.
I have the fan on. I can turn it off, but I have the fan on.
Yeah, maybe try that because it's hard to understand a bit.
Let me do that and then repeat. Okay, sorry about that, but like I said, I get overheated really bad and then it causes issues. But I wanted to comment on Ace's thing about people going to the steering committee and if they can't go in person, could they do it another way? The last one, I think it was, I went through Zoom to listen to what they were discussing and learn what's going on, because that's what I crave since I'm stuck at home. And disability is very important to me because of my daughter and me and whatnot. I like to go to these meetings and learn what's going on. And so I like the steering committee because they let me go through that. I just need to know when it's on.
Thank you, Renee. That was much more clear. I appreciate you shutting off the fan temporarily for us.
Yes, thank you, Renee. Any other comments?
Sorry, Julie, I never know when people stop talking or, and pause and then want to start up again. I tend to interrupt people. But anyway, thank you for letting me know that you can't hear me. I know what that's like.
Thank you, Renee. Any other question? No. Okay, now, as promised, we're gonna Dawn, did you have something?
Yeah, thank you. Sorry, I didn't get my hand up quite in time before you beat me to ending it, but I wanted to say I'm going to be following this really closely as well. And I know Cindy, I know you'll be sending me information as you get it as well. And so I will be disseminating that information, whatever it takes to get it out to SILC and interested parties. If you're not already an interested party, just send me a chat, send me an email, let me know your email address and that you want to be on that list and I can add you. Otherwise, if it's something major, like one of those town hall meetings, I will be posting it on our news feed on our website. So just keep your eyes open on our website for those things too. Thank you, Julie. Go ahead.
Okay, so just a heads up, at 2:30-ish, we're going to take a break for the interpreters. But as I say, as promised yesterday, I'd like to invite John to finish his report. Take it away, John.
Thank you. I called in by phone. Can everybody hear me?
Yes.
All right, I know I got a issue with my computer and sometimes that causes an issue. So for clarification, we're still going to, still on the subject of trying to develop this pilot blind services program.
Yeah, I think we were trying to get recruits, right? Is that where we ended?
So this is Dawn Lyons. I know that we had decided that we had more to say regarding the support for the blind program that John would like our to see if we're interested in working with the Aging and Disability Services program on. And if they have our support. And I was actually going to suggest that someone make a motion, and please feel free to disagree with me because I've not mentioned this until now, but I would like to hear a motion that the SILC support this program moving forward within our budget means, and supporting town halls or meetings or any kind of forward movement to allow consumers to be involved in this process.
This is Ace. So moved.
Do I have a second?
This is Renee. I'll second the motion
Okay.
as to be involved in this.
Is there discussion?
I know we had more to say yesterday.
Yeah.
Well, this is Dawn Lyons. I really appreciate, John, that you are taking the extra added effort to include us as a council and as a community, and that you're doing your best to reach out, even though we didn't have a meeting before you had to get it on, your deadline was a little ahead of our timeline, but I do appreciate what you're doing.
Well, thank you, Don. This is John. I had somebody, I spoke to somebody this morning, member, and I guess what was passed on is really that there was probably some need for clarification of where we're at and what we're going. So that's why I wanted to make sure we circled back. I know I spoke probably fairly quickly in trying to get things out yesterday. But some of those clarifications is there isn't a blind services program within ADSD, other than the assistive technology for independent living program, and then the services through the Nevada AT collaborative that are to explore assistive technology and support informed choice. But Don is accurate in that is what I'm asking for is I need help supporting some of these avenues and opportunities to create these. What has been suggested, and I agree with, is having a hybrid. If we can do in person, we can do online, and we can do telecommunications to get input from people. We support those. The reality is we got a short amount of time to do this. Although I got an email internally that's probably a little bit more flexible than February 3rd. But ultimately, the intent of this is to get that voice from people that are affected by the services. I've been in this disability world long enough to know what some of the gaps are, but hearing it from the individuals is what's important. I'll end with that piece, and then I do want to make sure that I make the clarification of why we are here. And I mean, why we are here talking about a pilot program is because Raquel O'Neill reached out to an opportunity that Assemblywoman May Brown had created. She started this ball rolling by saying, hey, there's some barriers there. And I'm not going to get into the weeds or speak for her, but this is where it all started. And then she got connected with ADSD leadership, and that conversation happened. When her and I were able to finally talk directly, and we're kind of like on the same page of this needs to be, this isn't just about buying a bunch of canes to give out to people. This isn't about buying assistive technology and handing it out. There's a bigger issue here. And some of these issues have been around for, I know that one of the big ones is the lack of mobility, orientation, mobility training, independent living skills training, all of those things. If you're not vocationally seeking a job, those things aren't available to you unless you're 55 and older and you go through that older blind, right? We know what some of the gaps are, but if we're not listening to the individuals and finding out what those barriers are for them, we're missing the big step and just jumping into building another pilot program, which we haven't built a pilot program since the autism program. I was involved in that. That's how that program started as well. So this is our opportunity to reach out to people and get some input, and try to build this. I have no illusions that this is something big, but this is where we start, right? This is where we actually speak up and lend to get the voices from the people that receive the service. And then going forward, we demand that this happens more often, perhaps. So that's where that was at. The next step would actually be reaching out to the core group of people. Raquel, throw your name out there, and the rest of the people that are on the call that I've already talked to, is to really talk to people and say, how do we reach out to people and where? I've already inquired internally with ADSD about how we can reach people through the regional centers that may be getting services that would be affected by this. The aging waiver, Medicaid waiver, the disability waiver. How can we reach those people? But I want to hear from individuals to say, this is the best way that we can do that. Rather than creating a survey or sending an email blast, those things are all good. But how do we most effectively get the word out that we want to hear back? And I'll pause there.
Dawn.
Well, and this is Dawn Lyons. I'm not necessarily answering that question that you just posed, John, but I wanted to mention that yesterday, Vicki Esner and Havander Davis both stepped up and said they would be absolutely willing to help out. And so there's two people right there within our membership of SILC here that are willing and actually eager to help. So I know there's plenty of people in our community as well. And so oh yeah, Ace did too as well. I'm sorry, Ace, I didn't mean to exclude you. And so, yeah, we have quite a bit of interest, and I'll let someone answer John's question now.
This is Ace. John, I'm really looking forward to working with you as a senior who lives in a senior disabled community. I'm really interested in helping you with this project. And I want to just say thanks to Raquel for getting the ball rolling, and then John, you picking this up, and then also bringing it to the SILC. As an ex-chair, I sure appreciate you doing this, because so often the SILC has been left out of the conversation. We've not been at the table. And so I just want to throw my 2 cents in there and just say thank you to both, and then also to all of us who have stepped up and are willing to help you, John, with this project. So, all right.
Yeah.
This is Raquel. I just wanted to quickly say that, I do really appreciate it. It's been a long time coming that the blindness community needed to get together and create a larger voice, a solid voice across the state, not just in our own communities, but I think across the state. And I'm looking forward to seeing where this goes. I'm hopeful that it does give some resounding, singularity to our voices and our needs, and hopefully make some room for some changes. And so I absolutely am hopeful. And I think to answer your question, John, as far as Blind Connect goes, and I know with other blindness centers around the state, maybe if we could get I just know with our folks, no matter where you're at in vision loss, the best way to really get information is just sitting down with a group of folks and letting people speak their mind or process and hear it as a group, either whether that's in person and or on Zoom, like in a hybrid setting. I know our support groups at Blind Connect, the people attending have been told about getting ready to be able to speak up about services and needs, and they're really excited and ready to do that. I think we would just probably need some kind of a note taker or somebody to take down the highlights. But if we can coordinate and set up pretty quickly a few dates and times, maybe in the north and in the south, and get the blindness community a call to action to come together to talk about it, I think that would honestly be the best and most efficient way for our community, from what I'm gathering from folks.
Is there any more discussion on the motion? Do people want to motion read again? Okay, all those in favor, please indicate.
Hi.
Aye.
In favor.
Aye. Any opposed? Motion carries. John, do you want to continue? And then
John, I think that motion passed, and she's asking you to go on with the next agenda item, if you don't mind.
yeah.
Okay,
Thank you,
perfect. Thank you. So to close that, the next thing will be, I'm going to be reaching out to the people that I've already been in talk to, either by email or whatever, and try to flesh out some of those things about reaching out to the things that I've mentioned, early intervention. There's somebody within our agency that we can do these things through, and I have a commitment through our agency that we'll find out who those people are. I have no illusions that this is not going to be kind of messy. We haven't done this in a long time, right? To reach out to consumers, but let's find. I hope through this we find a better process in doing that. So be patient with me. Thank you. I'm moving on to the reporting. So there's three things that I was looking.
Could you keep it under 10 minutes?
I'm sorry, I didn't get that.
Could you keep it under 10 minutes, John?
Oh, I hope you're joking.
No.
No, I'm kidding. It should be.
Okay.
So the three things that I wanted to bring up are we have the annual reporting, which is the 2022 annual reporting. And I'll just do a really high level. I know Dawn and Wendy sent out the updated report. Going through all of those details in the way the federal reporting works is probably not what we need to do so much. I'll just hit the high points, but if anybody has any questions, either now or later, please reach out to me. The second piece was yesterday, I heard the request for Clio. I could do a screen share and kind of just go over a high level of what the Clio is, and show you where we were at as of December. I've even pulled the Clio together for a year's worth of time. But really would just be an opportunity if the council wants to look at that and ask some questions about what Clio is. What my historical knowledge of it was when I started filling them out and what I was told it was for. I'm willing to do that if you want. And then the third piece is kind of like where we're at now for program stuff. Where are we at in this 2023 year? So does that sound appropriate?
This is Dawn Lyons. I would really like that.
Yeah.
Do you want me to do a screen share of the annual reporting data, or do you
Yes.
want me to speak verbally?
Could you screen share?
Excellent. I'm gonna enlarge this quite a bit so that as I go, and I'll apologize for my scrolling. I'm an erratic scrolling machine. I'm gonna jump to the first section of the report and where it typically lands in your annual reporting. The initial part, and I believe we're the only one reporting to the SILC consumer caseload stuff, and that's reported in this section. It lists out the number of consumer service records that were carried over from the previous year and how many were created during the year. So that's 216 were carried over from the last year. That's because we have a wait list. We have consumers whose services aren't completed from year to year. Some of these services may carry over for multiple years until the independent living goal can be addressed or resources can be secured to complete that. So 320 consumers is basically what we're reporting in your not 704 report anymore, your annual reporting.
Hey, John, this is Dawn. I was actually thinking you were going to share the Clio.
Oh, well, I started off with reviewing this, but I can jump to the Clio if that's what we want to do.
Yeah, if you want to, we can talk about some of this during that agenda item when we review the PPR.
Okay. Let me find the Clio report. 2020. What I'm going to do is I'm going to pull the actual month. These are reported monthly to within the agency. Let me get the actual December Clio report. All right, I've got it highlighted on the screen. All right, I'll give you the background as I know it. I've been working within the Clio report for coming on 15 years. Each program that had Olmstead implications reported Clio. It was the description that I got back starting with Office Disability Services. The intent of the program was to look at caseloads, right? How many people were coming into the program, how many were exiting the program, how many people were on the wait list, under 90 days, over 90 days. A lot of that information was collected and went directly to the director's office to be reviewed, and that was done every month. I believe that that still happens, although it's kind of not at the level that it did back when I started with Office Disability Services. So this is what the report looks like specifically for the Assisted Technology for Independent Living program. That program is the program that's been around roughly 30 years, addresses essential daily living, independent living goals, where assistive technology can apply and remove those barriers. So what this report consists of is, of course, the new applicant, and it's called applications in the report, but that's the new consumers. In the month of December, we would be reporting 11 new consumers, have established independent living goals, and have an independent living plan or waive that plan. In order to be a consumer, there has to be a series of goals, and there has to be a consumer service record. That's 11 consumer services records created in the month of December. The next section that I'm highlighting here is the wait list and pending applications. In the case of AT for independent living, this is the wait list of people that have independent living goals established. There's a plan in place or a waiver of a plan. These are actual consumers that are not active. We don't have resources to move forward with something in their plan. So we're highlighting not applications, not people that are pending an application into the program, but these are actual consumers that have those goals in place, but we don't have the resources to move forward. That means like buying, paying for a ramp to be built if that was the solution or what have you, whatever the solutions needed to be to accomplish that goal. We have 57 persons as of the end of December on the wait list. 15 of those consumers are under 90 days. So they haven't been waiting at least 90 days. The remaining of the consumers over 90 days, there's 42 consumers. Again, this goes back to Olmstead language, right? Providing services under 90 days to an individual. Now, granted, maybe everybody that's in receiving a service through the AT for independent living isn't in that high prioritized, they need the service or else they're going to be institutionalized. We have things built into policy and procedure in there to help identify those and try to eliminate those barriers to keep the person from ending up in the care facility. But this language that was built into the CLIO was to identify that, right? How many people are waiting under 90 days and how many people have went over that 90-day mark. The next section of the report that I'm highlighting is we report what's the maximum days on the waiting list. The oldest, the consumer that's been on the waiting list longest has been on there 303 days as of December 31st. But in this report, whoever's reviewing that at the director's office or in the leadership of ADSD would be able to see whoever's on the ATIL program the longest has been on there 303 days. Every month, that number is going to go up by 30 days unless that case becomes active. There's some statistical information here, time until placement. What time until placement means is that until that consumer's case becomes active. What we mean by active is that we have the resources to go forward and buy the assistive technology to address the barrier. That's the simplistic way of saying it. Once we move them off the wait list, we actually have the resources to move forward with those solutions. So the person's place this month means there was 3 active cases. We also have the average days until placement. That average days is a 0.3. What that tells me, that number, when I look at this every month or in the middle of the month, is that all 3 of those cases are probably prioritized. I know they're prioritized because the average days is 0.3. That tells me that as soon as that person's consumer service record was wrapped up, the goals were agreed upon, the consumer signed it and said, these are truly my goals, the case was made active. We got the maximum days until placement. There's 1 maximum day. Essentially, all that data tells me is that it took about a day for that plan to be received, saved, and everything, and they made that case active. They're moving forward with some goal that person has that is a priority. It's a priority to keep them from going into a care facility or to get them out of it. Client caseload, active cases. For this program, the active cases means these are all the cases that have at least 1 active goal that we're moving forward with. And we have the resources, we have the state dollars to actually pay for those assistive technology pieces. So there's currently 111. Throughout the year, that number is going to fluctuate. If we have more priority cases in the month of January, or somebody that's currently waiting hits that priority status, we follow up with them and find out it's now a major issue, that number of active cases could expand. I'm going to jump into the weeds here a little bit and say some of the funding that Cheyenne spoke of yesterday, the recovery funds that have been are on their way to approval to help eliminate some waiting lists. That will impact this program. When we get those resources, we will be making a number of cases active. As far as we have dollars for, all of those cases will be made active, and this number would increase. There's some stuff we've built into the report that doesn't actually go further than my office, and that's, you know, average age of the active clients, the maximum age of the active client. That's some stuff that I had built in there because I just wanted to kind of get an idea of what we had going on demographically.
Hey, John, you have 3 minutes, and we have to take
3 minutes?
Yeah, we have to take a break for the interpreters.
Very good. I'm almost through the Clio report here. The monthly report also reports the case closures. Average days until completion, that's an important thing. How many days did it take for one of those cases? That's the average days of completion are about 603. The maximum days until completion, one of those cases had been open for 1,324 days. That's not a result of there not being resources. Sometimes that could be a result of it took that long for that consumer's goal to be met for any number of reasons. Their life, things in their life, things in the program, so on and so forth. Average cost of closed cases, that is really just looking at these closed cases. All the expenditures that were for those cases averaged by the number of people served. I'm going to skip down a little bit with the short amount of time we have here. The closure reasons, these are the overall closure reasons as defined by your federal reporting. How the reason why that case was closed, goals met, died, moved, withdrawn, or other. Those are overall closure reasons. We took it one step further in creating our reporting, that we wanted to really look at the actual goals and the reason why those goals those goals closed, forgive me. So goals met, if we were unable to contact the person, if the individual withdrew the goal, if the goals were active in progress or solutions available. All of these goal statuses is what we built into our project to really be able to kind of flesh out where somebody was at. Are they pending a solution? If the goal was pending a solution, that means we've got to work with that consumer and find out what that solution is. So we can get more into this when the council has more time, but this is a Clio report as it looks for the AT for Independent Living program. I see Dawn's hands up, so I'm gonna mute for a second.
Thanks. This is Dawn Lyons. Thank you, John. I appreciate you going through that Clio report. And just to clarify a couple things, I did look it up, and Linda, I believe you said it yesterday and you were correct. It is the Caseload Evaluation Organization Report. So I wanted to make that clear to everybody because we were all confused about what it actually meant yesterday. But also, when you say, I just point of clarification here, John, when you say average amount of days until completion, you're talking about one client with all their goals, correct? Not just each goal and how long that particular goal took.
John Roseland, for the record, yes. That's one individual's consumer, all of their goals put together. So that's not common to see 1,300 days, but it's also not uncommon. A consumer, it may take two or 3 years for them to get their resources together to their portion of a resource. Let's say for getting a modified vehicle, if that's the solution that was most appropriate for them to accomplish their goal. So yes, it could take that long.
So thank you. This is Dawn Lyons again. So this a question for the SILC then at this point is, something to think about, maybe not making a decision now necessarily, but to think about is moving forward. I know that John's reports have been very valuable, kind of lengthy, yes, but very valuable to hear that information, and especially the qualitative data that he brings back, and this consumer satisfaction survey is really valuable information as well. But something to think about moving forward is the Clio report, does that cover most of it? And would we just require certain aspects that aren't included in the Clio for John to report to us in the future if we support, as long as we're supporting his program? Or what do we exactly need to hear? Because some of it does overlap. So I just wanted to point that out to the group and see, if we needed to have a conversation on that now, or if you wanted to just think about it and, come back next quarter and discuss it more.
John, could you, Mary,
Yes, thank you, Julie. Hi, John. I like what you're doing with the Clio report, John. That's so detailed. It's wonderful information. In the past, I noticed you've just used your PPR report to report your demographics and your reporting information. So the Clio report is something you do in addition to the PPR report. That's correct, right?
Correct. John Roseland for the record. Thank you, Mary. Yes, the Clio report is a internal state reporting. Like I said, back when I started, it was part of this the Assisted Technology for Independent Living program, which, like many other programs within the state, have homestead implications, right? There was the PAS program, Personal Assistance Services program. Many programs back at that time were on that original Olmstead plan, right? Those were some of the solutions to creating additional opportunities that were highlighted within the state. If that's, I think that's an accurate way of saying it. The AT for Independent Living was one of these alternatives. It provided things that weren't available through Medicaid, but it was highlighted because it was addressing those barriers that people may have that there was no solution for. Hence why the SILC created this back 30 years ago, I guess. The reporting itself is something that was created internally. So it does have those aspects of what was created by the director's office back 20 some years ago. I don't know when this thing came about. I think my time with the state started in 2008. I know that Clio existed before that time because of my work through the Center for Independent Living, where we had to have certain stuff updated for this report to happen.
Okay, very good. Just my 2 cents worth, John, if I may, please. I think we're more used to your PPR report, with your data on there, your demographics. Either way you do it, it's always a good, very good detailed report. So thank you. That's just my 2 cents worth.
This is Johnny, and just one point of clarification for everybody that's not aware. The reporting data that we provide for your annual report as the SILC is the same data that is provided through the SILCs. The CILs. It was modeled after that. The reporting is completely in line with that. Mary and Lisa are very aware of the number of consumer service records carried forward, completed. All of the demographic stuff mirrors what the centers report. So having an understanding of that, and then I think really educating so that people can go, we want to find out a little bit more information about this certain area. And I say that because I know that Mary and I've had this conversation about what they do to expand independent living goals as far as housing, if I remember correctly. But there's areas where the SILC may need more detail or to have a better understanding, and that's where we can really come in and figure out, can we build something in there to collect greater detail or not? The average days and maximum days, I can pull that information out by consumer, and we can get rid of we can look at the median once we get rid of the higher stuff, right? We have accurate numbers that we can pull. So whatever I can do for the SILC to have a better understanding of what this caseload means, reach out to me and we'll figure it out.
Yes,
you.
thank you, Jen. I know these conversations, our reports look like yours. They go on for miles down to the most specific detail. But for the public, we just usually put it all together and say, these were our housing goals. These were our advocacy goals. If for us, we're detailed, and the detail comes in what's the barrier in meeting the goal? What's the holdback? But thank you so much, John, for your information. It's always appreciated.
Hi, this is Ace Patrick for the record. Thanks, John. So I'm trying to figure out like what the SILC might benefit more from is your PPR report or the Clio, and because this is the first time I've heard you report on the Clio, I guess. So I'm not really sure. I guess I'd like to hear what you think would be more important, to stick with your PPR, which seems a lot more, it seems a little different, or the Clio. I mean, which do you think would benefit the SILC from hearing more about? Sticking to doing the Clio every time, or going back to the PPR? So I'm sure Dawn has something to say about that too.
Yeah.
I mean, both are data driven and they're both very interesting and both very important for us to hear. So thank you, John, thank you for John, thanks so much for everything you do. I mean, this is it's a lot to take in sometimes.
This is Dawn Lyons. Before you answer that, John, let me just chime in here. I actually would suggest, because I do believe that the quarterly reports that John reports to us in alignment with the CIL reports and how they do things, that makes the most sense to us. That really speaks to us. We understand his data. We understand what he's saying. It flows better. This is new to us, so it might take a while to understand, and there is some overlap there, but not as much detail. So like what John was saying, my suggestion is just to, because we're asking for the Clio report on all ADST programs, is that John not necessarily have to give a detailed report on his Clio, because he's already giving us his report on the IL program separately. So when Aging and Disability Services provides us with that Clio report, it will include AT for IL on there, but we won't necessarily need any more detail from John at that time. Does that make sense?
Yeah.
This is Ace, my hand's up, and I know, but I was going to say, okay, that makes more sense to me, Dawn. Thank you very much, because this is new. So otherwise, I was going to suggest that we alternate. You know, that one meeting, you know, he does the other, and one meeting he does this. I don't know. I guess have to figure that out. But thanks.
I don't want to cut off Julie.
Go ahead.
Yeah, the Clio stuff, you've made the request from the agency to provide it. This is done every month regardless. So what I just want to keep echoing is that if you have any questions about that data, ask me about it. I find a lot of value in the data because it's really where I find gaps in services. I find issues. If I find why there's a case that's open for 1,300 days, which we have built in, I mean, when you want to get into the weeds of why all this stuff is important, we'll get into the weeds and we'll relate it back to the goals that we have for community partners and everything. This stuff has good meaning to it. But the expanded report that I've historically given the SILC has a lot of information, but I try to break it into the stuff that also has bigger value. The data tells us what we need to, what we know are gaps in the community, right? when self-care is the number one thing that people have. We know that we have a narrow focus. It's essential daily living, right? Your daily activities, daily activities of living. That's a very small thing. That's like the essentials. But when we have still, after over 25 years, I think it's over 30 years of program. When we historically still have this as a gap, it's still a gap, right? People aren't calling us and waiting 18 months because they have nothing better to do. These are significant barriers. The big three are usually home and community access. That's getting in and out of your house, in and out and through your home, and self-care. And then I think the third one is usually mobility and transportation. You can't have those being priority goals for this amount of time and it still not being, pretty significant. That's just me saying that, but I think the data supports it. But also looking at the survey data, which I popped up in there. Don, I seen you added it to your guys' annual report. Those are the big things, right? That we have people responding to the surveys voluntarily. We want people to be able to say how this impacted their life. How a lot of the things that we asked in that survey are important questions. If we want to expand them, then we can. These have been around for a long period of time, but I find value in the report that I've historically provided to you, not the annual report, that expanded one. Yes, it's a lot of data, and I'm sorry it takes up a lot of time. But at any point in time, you're digesting that, even 6 months later, and have a question, reach out to me, and we'll get into the weeds with it and figure out what we need to do or what that data actually means.
Thank you, John. I do have quick questions. Okay. We're gonna take a 10-minute break and come back around 3-ish. Okay. Welcome back, everyone. Now we're gonna get some reports from the Centers for Independent Living. And I'd like to remind everyone to keep their summaries under 10 minutes, if possible. And the first one up is Mary.
Thank you, Julie. I'm trying to turn my camera on. Doesn't seem to be working, but that's okay. We don't need to see me. Let's see. Okay, well, we'll do it without a camera. Good afternoon, everybody. I'm Mary Sizer, and I'm the director for the Southern Nevada Center for Independent Living. And we have two centers that are ACL in compliance per Section 725 of the Rehab Act. And what I'm reporting on are the trends and our numbers for October 1st to present. So this is a quarterly report. I would like to add that we have finished and submitted our PPR report. Those were submitted in December, and then we will submit a copy of those to the SILC once they're approved by ACL. And then Wendy, is it possible for me to do a screen share?
Yes.
All right. So I'm going to go over here. Okay. Let's see. Screen share. Okay. Can you see that?
No.
Wendy?
No, we can't. Mary, did you go to the bottom of your screen and click on share screen and then choose that and then choose OK?
Can you tell me where share screen is on your icons?
So on my computer, if you hover over the bottom portion of your Zoom screen, a pop-up menu comes up, and in the middle, in green, it says share screen. You found it.
I see it. I see it. Let me get the right report, graph 6. Okay, can you see it now?
Yes.
All righty. Much like John's report, we track individual services, and this quarter so far, we've had about 38 new intakes. There's a difference between someone that just calls for information. On here, we have 540 calls listed. Of those, actually 512 are casual consumers. Sometimes we're able to help individuals, guide them through INR if they have a technical question about Social Security or Medicaid or paratransit or where do they find an accessible swimming pool. So that's not marked as a direct service. That's an indirect service, but we track them, and we know that 38 of those were for direct services. That's what we can report on to ACL. So of the people calling, 8 of them, and then Don, I did this just for you. I haven't put it in there, but 8% requested advocacy or legal services. 2% requested assistive technology services. 37 or 97% requested assistance with housing. 3 requested IELTS skills training, or 8%. And then we have 2 or 5% requesting, let's see, it's other, and then 2 requested peer counseling services. Then we had 11% that requested transportation services. When we do a new intake, we write, or we don't write it, our consumers will write the goal, then we write an action plan, then we track that through case notes. We set a time frame, which and only if the consumer agrees, because the consumer has to agree to a plan. They have the option to waive the plan or not waive the plan, but we are mandated to keep contact notes and then to keep a goal that has been signed. And then what we do is we track the goal, much like John. We find out where the barriers are. We contact individuals 30 days after they open a case, 90 days, and then 180 days. And when we do that, we're also doing our satisfaction surveys to see how they're doing with the service. We do the 30-day because a lot of our consumers will call, we'll set up a plan, we'll set up a goal. Then they forget who they called. They'll forget who they're working with. So we call them, remind them, ask them how the service is going to start out with, and then try to get them on track with their goals and their action plan. At a Center for Independent Living, the consumer takes the lead. We don't tell them what to do. It's their goal, it's their life, but we are there to provide peer counseling, guidance, support, and information to help them to meet the goal. So that's our first quarter numbers. And again, our numbers, we're very particular with them because we like to screen them, test them, and make sure they're completely accurate. So these we call draft numbers. We did 21 outreach activities during this quarter. And then we also had the final expenditures for our CARES Act money. All in all, with all of our CARES Act money starting in 2020, we provided groceries, hygiene, cleaning, and PPE orders, a total number of 644. We had 17 consumers that were incapacitated by COVID, so we provided 17 meal deliveries. We provided 298 rental assistance, and those included our nursing home transitions. And then we had 5 requests for technical and communication assistance. Please ignore the yellow, those were notes to each other. Then we use social media ongoing to announce events. We had COVID vaccine campaigns, and on our website, we updated it with CDSC reports for vaccines, our employment opportunities. I do want to report that with our Youth Leadership Scholarship, with the SILC, we have our open invitations this year. This year, we've invited not only teachers to submit candidates for the scholarship opportunity, but also the school to work transition coordinators at the schools. And then we had Disability Awareness Day. And I do want to mention really quickly with the CCSD, the Clark County School System, they did come to us and they wanted to know if we could help them to turn their Star Fair into a DAD, Disability Awareness Day. So we're partnering with them to do that on April 26th. As soon as the flyer is ready, I would like to invite especially Cody and all of our SILC council to attend. It's a very important day where all of the Clark County school students with a disability attend, but we want to make it fun. We're going to have lunch. We're going to have a car show. We're trying to get radio stations out there, and we are looking for door prizes. Okay, with that, I'm going to close the screen on this one, but I have some other results I want to share with you. And I want to share the results of our DAD that we had in October. Is this showing on your screen, Wendy?
No.
No, okay, let me minimize it and go back to my screen share. Thank you for your patience. Share. Then we have our, all right. How about now?
Yes.
All right. We had Disability Awareness Day on October 8th, 2022. We had it at Lorenzi Park, which is a location we've used for almost 32 years. We do our best to collect surveys at DAD. And like everybody else, we wish we had more, but we were able to gather 16 surveys. Of those, 15 were excellent responses. One was an average response. We asked consumers how they liked the location. All or 100% said they liked it. Organization responses, we invite a lot of organizations to be there to provide information. They were happy with the information that the vendors provided. And I know that Don and Cody were there. And Cindy, you came to DAD. It was so good to see you and meet your family. Then excellent responses, we had 14 for the time of the day. 2 were average. Professionalism of the event, 16, so that was a very positive response. We had some recommendations, maybe later in the day, maybe when it's not so hot. Directions for entrance for parking, we could do better on that. We are going to try to do better. Start time for vendors could be a little later. We do know that people struggle with a PCA in the morning, so we're going to look at that. They want maybe the governor or the United States president to come. We'd love to have that. And somebody said, I love the way it is. I love the event. It's a lot of information, more things about seniors. We do want to get more seniors and seating other than the grass from the stage. We do put chairs there. We'll put more out next year. And then they want a diagram location of the event. We can do that. Then we also ask, who else would you like to see here? And Raquel, we had 2 people requesting that Blind Connect come to DAD. And I know that you guys have the white cane. Well, the Nevada Federation for the Blind always has the cane day, the very next day after DAD. We're going to talk to them sometime to see if maybe we can combine our events. Also, somebody requested that PBS would be there. And then at times we do have intakes for disability services right there at DAD because we are short-staffed right now. We took appointments. We didn't do intakes at DAD. And then new wheelchairs. We have a group that can provide new wheelchairs. We're going to invite them. They would like to see all PCA services there. And then too many to think of, everything of the event love. And they would like to see Southern Nevada Aging and Disabilities have a more prominence there. So that, let's see, City of Las Vegas accessibility person, hearing technology. I'm not sure what this was, but anyway, okay, so the total attendance was 282. Then we monitor materials, and we always report on materials that we give out. Vaccine bags 43, keychains 74, candy bags 74, vaccine t-shirts 21, SNCIL bags 113, 252 sanitizers, 150 masks, 50 face masks. We had surgical masks and regular face masks. Our pocket guide, jar opener, pocket guide was 95, jar opener 66, keep it clips 248, Spanish brochures 26, English brochures 63, and SNCIL bottles. We gave out 2 cases of bottles. And that's my report. And I appreciate the time. And I know we're going to be a little bit short on time today. So Julie will open it up for questions. I want to note that I really hope we have enough time for item number 16 and 18, because there's some things we don't want to rush through during our SILC meetings. So Julie, thank you for everything. And to all our SILC members, thank you for everything. And I do apologize for overwhelming you with numbers. I know you've had a lot of numbers today, but as John said, if you have questions or think of a numbers question later on, we're always open. So thank you.
Thank you. Time.
Thanks. This is Dawn Lyons. Thank you so much, Mary. And I really do appreciate those percentages. I know maybe it's not everybody, maybe it's just my brain and how it works, but that really helps me to understand that better. So I appreciate you including that. And I do like that you went through the DAD numbers with us. I appreciate that too. That's important information for our community. You know, we tried to get some surveys completed at your event as well, and we didn't have as much success this time as we did last time, so I can see why your numbers were a little lower too. I don't know, maybe it was just the atmosphere of being in the tail end of COVID or something, I'm not sure, but I know you've had a lot more attendance in the past, so it was a good event regardless, and we did have a lot of good feedback. So thanks for providing that to us.
Yes, we have a lot of other activities October here in Clark County. You either do your event in April or October because you missed the weather. And then also last year the one year we did surveys for the SILC Dawn, I was able to get the young Civitans to volunteer to help us gather surveys, and just things have changed since the pandemic. People don't come out as much. So I'm going to try to get them for next year to come out. And then we will try to get more of the groups come out that our consumers are requesting. And I do know that I invited a lot more groups, but it's the time of the year and everyone has their events at the same time. And we know and understand why. And I even have some of my staff going to other events. So we're all kind of scattered, but DAD is there, we're there, and we will be there. And so thank you guys for coming.
Any other questions? Mary? Okay, Lisa, you're up.
Hello, can you hear me?
Yes.
Great. I am not going to turn my camera. I hate that it sounds like a broken record with all of us. I'm having an unstable internet message, so I'm going to have to just, you're not going to be able to see me. Anyway, I'm going to follow suit with Mary because she's such a great example. And I would like to report on our service requests October to December. So that's the first quarter of this new operating year. And in that quarter, we received 106 service requests, new service requests. 40% of those were from rural counties. and 60% were from Washoe County. 63% of the total services were requests for general information, INRs, as Mary said, things that can typically be completed out easily, connecting folks with other services in the community, that type of thing. We participated in 4 outreach events, one in Winnemucca, and let's see, the other 3 were right here in Washoe County. 14% of our total services were housing, home mod, and shelter service requests, and specifically housing search, rental assistance, eviction process, home modification requests. So those get, our staff works through with our consumers on those issues. 4% of our total services were assistive technology requests, and most of those were for blind and low vision technologies. 5% of our total services were general advocacy, providing assistance to mitigate landlord-tenant issues, disputes and follow-up on SSI, SSDI applications, veterans services, guardianship processes. Looks like we finished we had a year-long campaign in the rural communities during COVID. And we finished out our direct mail campaign. We mailed out more than 42,000 postcards targeting residents of Elko, Carson City, Gardnerville, Minden, Spring Creek, Yarrington, Lovelock, Winnemucca, Fallon, Fernley, and Dayton. The postcard messages, the first one was independence is accessible. All of these postcards directed people back to our website, and we made a point of really making our website very robust. So the next one was employment assistance, and the one after that was like upcoming events. The direct mail campaign resulted in 4,004 visits to our website, and then those get farmed out to staff. And one of the conversations we're having at a national level, because a lot of the centers really beefed up their website over COVID, is there's no way to capture who got their questions answered right on the website, and didn't really require us to intervene anymore. So that is something we're going to have to play with and see if we can't figure out how to capture some more information around that. We continue to have a very consistent social media presence, Facebook, Instagram, all of the things. We also launched our independent living news letter, which goes out monthly, typically the first Monday of every month. And that newsletter highlights important NNCIL information and community events, general public information regarding disability resources, and also there's a topic of interest. I believe this month has a lot to do with weather, and we picked the right month to do that. So that's been going out on a regular basis. And then October to December, we had held back some vaccine money that we had received because we wanted to do a push in the late fall and early winter, those months at the end of our year where the weather's starting to change, and do a reminder campaign about boosters and flu shots. So this money was solely for rural Nevada. And it went out, we worked with the following radio stations. Let's see, KLCA HD4, KODS FM, KRNO FM, and KLCA FM. And we also had billboards up. We had billboards in Fernley, Winnemucca and Imlay, Gardnerville, and Silver Springs, as well as bus panels on the jump around in Carson City, with messages, take a shot for independence, with our contact, and also targeting, if you have a disability, we can help you get vaccines and masks, so contact us. In addition to that, we have our ongoing activities, monthly peer group meetings in Carson City, Gardnerville, Fallon, and Fernley. We have weekly online peer group meetings. We are a provider of I Can Connect services, which is through the Helen Keller Foundation. So it provides equipment and training for people who are blind, low vision, and have a hearing loss. And that's kept us pretty busy in our operating area. And then also we collaborate with the Cerebral Palsy Agency, and one of my staff members provides sex education classes over there. And I thought it was kind of interesting to note that the last year, so the last reporting year, we put approximately 2,000 highway miles into getting out into Nevada. So a lot of windshield time, because as we all know, there's little pockets of people and there's a lot of sagebrush and rabbits in between. The other thing that we did was, as far as a SILC funded project goes, is the nickel scholarships. So we completed the reporting for the last round, and currently we are prepping for the next application period. I'm in the process at the moment of scheduling a conference call with the winners from last year who actually went to Washington, D.C. One of the things that we had asked them to participate with us afterwards was to help look at the application itself and make recommendations to us, maybe better questions to ask, better distribution paths, how to make it better. So that's the start of this next round. And once again, we will plan to fund one student with a parent chaperone from the rural areas, and then one student with a chaperone from the urbans, and then one teacher from both. So one teacher from urban and one teacher from rural Nevada. And I guess the other thing I would say, just slipped right out of my brain. Doggone it. What was it? Oh, as Mary said, our PPR was submitted in December. And when it becomes, when it's accepted by ACL, it'll be ready for distribution. And I think that ties it up for me.
And Dawn,
Thank you. This is Dawn Lyons. I am so excited to hear all that information about what's happening with NNCIL, Lisa. It has been so long since I've heard so much about what's going on, and it all sounds so amazing. I love hearing it. I have a question for you. Out of the 106 new clients, how many of those created a plan for themselves, and how many refused? Do you know?
I would have to go back into the data. I don't have access. I'm having all of these wonky issues at the moment, but I can certainly ferret that out. I will tell you that in our office, more people waive than actually want to do an independent living plan.
That's a conversation I'd like to have at a later date, actually, between, both centers and the SILC, is just to discuss, how we can improve that, how we can, maybe we can support you in some way in promoting that. I don't know, but I get that impression that a lot of people in Nevada just don't really understand what the importance of in making a plan is. And maybe John can even chime in, because I know he has some good results with his program. But thanks for that. And then I had another question, but I can't think of it now, so I'll let other people ask first.
Ace and Larry.
Hi, this is Ace. I have a question. Let's see here, because I was going to go back here and look here. Somebody just asked me a question that's listening in. We're asking about the board meeting Zoom link being made public for both SNCIL and NNCIL.
That would go to my board. At the moment they have voted not to have that public because we were kind of getting bombed.
Okay. I think a lot of the public, though, would like to be able to hear what you're doing, Lisa, just, in my input. The other thing is, are you at least publishing your meeting minutes for us to see?
No.
If we're not able to attend? No. Okay. The other thing is will you be opening the physical doors so people can come to the building again?
That's where I was this morning. We're prepping the building.
Prepping the building. Great. Good news. Good news. Also,
yes.
awesome. Yeah. Also, Also, too, I've had some consumers ask me if you will be starting up the grocery program again.
No, that was funded through CARES Act money. And so that was a one-time program. You know, when CARES Act sunsetted, that money went away. We did
Okay.
spend down every dime of our money, though, just
Right.
FYI.
Right. I hear that you on that. Is there any opportunities out there at all for you to start something like that again? For those of us?
Centers for Independent Living, that during CARES, that allowed us to operate outside our scope of service.
Okay,
Centers for Independent Living typically cannot provide that type of service.
got it. Okay, thanks very much for answering my questions.
Okay,
Thanks for the questions.
there he is, then, Dawn.
Mary,
Oh.
she's, oh,
Yes. Oh, well, thank you, Julie. Thank you, Lisa. Good report. Always good to hear from you. I wanted to say regarding the waiver, centers used to, we used to have a different intake, and then right on the intake, it says, would you like a plan, or are you going to waive your plan? Yes or no? Then, and then John came with us. We all went to a training. It was a training by ILRU. It was a holistic training on providing centers for independent living services. And then they developed some standard forms. I think both Lisa or NNCIL and SNCIL developed, we adopted those forms. And now there's a separate page where it says, would you like to develop a plan? This is what a plan is, or do you want to waive the plan?
Right.
For some reason, if you put all of that there, consumers just say, no, I don't want a plan. However, at a center for independent living, when a consumer waives a plan, it's okay. That just means they don't want a copy of the plan. But we're mandated by the Rehab Act, even though they don't want a plan, we develop goals. We have goal sheets for each goal. If they have a goal, let's say they're requesting IL skills training for paratransit application, you know, number one, you do this, number two, you do this, we'll work with you on this, Do you sign this goal? Is this acceptable to you? Because we're consumer choice, the consumer writes the goal, not us, but they have to write the goal, and then they have to sign they want that goal. What a plan is something we put together to track the goals. And then with our software package, whether or not they decide to accept a plan, we're mandated to keep contact notes, to keep track of the progress, to keep track. We had set a starting date here. Did they miss the starting date? So if they waive the plan, that means they don't want a copy of the plan. But for us and our team, we're mandated to keep records and contact notes just as if though they did have a plan. So, and we work very hard to get them to sign a plan. However, it's consumer choice and they have the right to say no. And the old way we used to do it, just about everybody used to say yes. And I can see why in John's program, they would accept a plan because they're signing up for something that's fiscal. They're signing up for funds to assist them with something. And then in John's program, they also have to sign up to bring to the table their portion of the money. So I just want to share with the SILC, it's not that we're not trying to get plans signed. It's a consumer choice. We're not going to force them to take the plan. We cannot do that. At CIL meetings, we have had that discussion over and over with the Centers for Independent Living. The consumer comes first. If they want a plan, that's their choice. If they don't want a plan, that's also their choice, but we know what we have to do either way. Anyway, just wanted to put in that clarifying point. And
Thanks, Mary.
One more thing, there seems to be some confusion about, okay, Centers for Independent Living are 501c3 nonprofit organizations. Our boards are tasked with the role of developing our fiscal plans, They are tasked with the role of developing our policies and procedures, our employment manuals, our accounting manuals, and, and they are tasked with listening to our reports for what we're doing. Are we meeting our goals? We develop a work plan at the beginning of the year. We work on the work plan. So again, our board voted no to open meetings. We're not mandated by the state to have open meetings. If anyone has a question on what we're doing as executive directors for the centers, we are more than happy to meet with you and answer any questions. And then we're more than happy, to provide, reports at the SILC as to what we're doing. Lisa and I did, and we talked to our liaison, our ACL liaison and project managers, and CILs are not mandated to have public meetings. There's a little bit of confusion that a CIL is like the SILC. The SILC is a state entity. It is mandated by state law to follow the protocol of the state meetings. A CIL is a 501c3 nonprofit. They do not have to do that. And therefore, we've been doing all these years just with our board. We treasure our board because they are our leadership. They are what keeps us going. Without a board, we would not have a center. Our board, per the IRS, we are mandated to have a board. The board has certain mandates that they have to complete for tax laws. The board has certain mandates that they have to complete for ACL compliance. And then as executive directors, we are here. We can field the questions that the community has. And so I hope that explains it. And then Lisa and I did do some research. We went in and the types of centers that do post their meeting notes, and we can understand why this is confusion. Okay, there's two types of centers. There's a Title VII Part C, that's Northern Nevada Center for Independent Living and Southern Nevada Center for Independent Living. Our funding does not come through the state. It goes directly to the center. Our state does not support the centers for independent living. In a lot of states, there are centers which are Title VII Part B centers, which the money comes to the designated state unit. Then the money gets flowed out to the SILC for Centers for Independent Living. We do not have any Part B centers here in the state of Nevada. But if you go and you start looking at centers, you're going to notice that the Part B centers have their meeting notes, have open meetings. That's because they're under the state. And per state law, if you have an entity under the state, they have to post their meeting notes and they have to make their meetings open to the public. So we can see where that confusion comes in. But if we had a center like that, or if the SILC had any other entities working with it, they are mandated to post their meeting notes. They are mandated to have open meetings according to state protocol because they're not a private nonprofit 501c3. I hope that clarifies it because it gets confusing. It does get confusing, but thank you for the opportunity to speak up.
Thank you for that clarification. I know. Dawn, do you have something quick?
Yeah.
I want to make sure we get to that.
Yeah, I know we have a lot to cover today. Thank you. This is Dawn Lyons. First of all, I just want to say that Ace brought up the point that the other question I was going to ask is, except that I was going to reference the executive order from the governor in all state employees coming back to normal or whatever, before pandemic circumstances. And I was just wondering if you guys were opening your doors due to that executive order, or, if that influenced you guys' decisions, or if maybe you're opening the center.
Oh, okay. Yeah, no, we followed the governor's mandates. And then, so that came out on May 30th. And
I'm talking about the one that just came out this month.
okay. Well, we opened up our center. It's a hybrid center now. It's
yeah, that's right. I forgot
that May 30th, because we had some consumers that try as we may, and using all the technology and all the Zoom, and it's due to cognitive functioning, and it's not cognitive because some of these forms confuse anybody. They are very challenging to go through. So I talked to our board and they said, yes, we've voted on a hybrid. So we have some staff there some of the week, but we work by appointment only because we are still very cognizant about, COVID hasn't gone away. We
No, that
know.
makes sense. Yeah,
So we have appointments and then we have a policy. How do we clean up before? How do we clean up after? And then we did some polling during the pandemic. We asked our consumers, do you want to meet with us face to face? Or is this working out? 75% of all the people we polled said, no, I don't want to meet face to face. I love that you can work with me by Zoom or by phone, or we can work together on the internet, because that in Clark County, and I know up north and in the rural areas, it's hard for people to get anywhere. Here,
Yeah.
even though we're in a metro area, on a
Mary,
bus.
I don't want to cut you off, but I know Julie's really, got a
Yes.
lot to get through on this agenda, and I appreciate your clarification. And I think your hybrid model is ideal, actually. I really like that. So I was just explaining what my other question was going to be, and but you guys had already answered it pretty much anyway.
Well, I just want to jump in. I didn't even know the governor put out another directive, because this has been, as we've been going forward. I will say our staff has been pummeled by COVID.
Mhm.
And we are, because of that, and because we're people with disabilities, we've been very, very cautious. And to Mary's point, and what Ace touched on earlier, we have most of the folks that we work with don't want to see us. They want their services, through the internet and through Zoom, or maybe just a drop off at their home or something like that. So, we are entering a new way of providing services, and we're feeling our way along at the moment.
Yeah,
Okay,
thanks. This is Dawn
Okay.
Lyons. I thanks for answering my question. I just I do think that there is another side to that too, because the other part of that percentage, I know there's a lot of people that really need in-person services, and they really need those peer support groups and those things, those services that can only be provided through Centers for Independent Living most of the time. So thank you for answering my question.
Okay, so Dee Dee, you're next.
Good afternoon, everyone.
Good afternoon.
This is Dee Dee Formaster. I'm at the Rural Center for Independent Living in Carson City, Nevada. And I must say we have had a couple of very busy months. In the fact that we did start a support group, which is, of course, / recreation group. And we have had immense success the last couple of months with that. But due to the horrible weather, we had to cancel our last meeting, but we're hoping to reschedule probably towards the end of the month. We also have gotten a hold of a couple of people here in town to get discounted rates to the movies as well as bowling, so that some of our people here in our area can start doing some recreation, because they are very isolated and very depressed. And so the support group meeting has been a wonderful plus, because we can stay in touch about vaccine mandates, and also have discussion about vaccines and about nutrition and how important that is in this pandemic that we're facing. So our housing program's going well. We don't have a lot of housing. We kind of had a crisis the last 2 weeks, where Carson City, in all their wisdom, decided to red tag one of the low-income housing complexes and threw 23 families out into the streets. They said, oh, we provided services. They handed them a packet from Health and Human Services, which I helped people fill out. They went and turned it in, and we're told, as soon as you find a place, let us know, and then we'll decide whether or not we can assist you. So there wasn't a lot of help in that respect. And so I have had a couple of conversations with the mayor about what has happened and how we need to better handle situations like this, because these folks did not even receive a 5-day notice. When they were thrown out, of course, it was in the middle of the major snowstorm with ice all over the ground. And most of these people are working poor, disabled, and also are elderly. And so it was a pretty miserable, horrible thing to have happen. So we've been working on that the last 2 to 3 weeks, I guess. And other than that, we have been out to our nursing homes, trying to work with them the best we can in helping them to find housing. And we have been out in our rural communities doing outreach and trying to help all we can with housing also. So that's about it. We've been very busy. Any questions?
Thank you. Are there any questions?
Okay.
Thank you so much.
Thank you, Julie. Thank you, Dawn.
Okay, I'd like to make some appointments for subcommittees. I'd like to appoint Stephen Kahn as chair of the legislative subcommittee. I'd like to ask Sandra Hasbro if she's willing to continue as chair. Sandra, are you willing?
Yes, I am.
Thank you so much for the energy you've put into this. I'd like to quit Deanna Gay, or I'd like to ask Deanna Gay to continue as chair of the transition work group. And thank you for your patience. And then I will be the chair of the school work group. And I'd like to propose that all the subcommittee find the time to meet with together for the legislative subcommittee to establish the priorities for this 82nd session. And I'd like to ask Dawn to help us coordinate that meeting.
This is Dawn Lyons. I would be happy to coordinate that. I think it's a great plan moving ahead to get us all together to establish legislative priorities under the legislative subcommittee leadership. So thank you. And if you don't mind, we have a lot of agenda items. If you don't mind, Julie, if I can just make some suggestions here so that we can get
Yes,
to what we need to.
please.
I would suggest that we table number 16 and 19 for our next meeting. And that we just get down to making some votes, necessary votes on these other ones and any important questions. So maybe number 14, since my name's on that.
Yes, please.
I would just like to say, I would like to hear a motion that the SILC approve our support for the employment first statement that our ad hoc committee has put together outside of our council in coordination with other councils such as the DD Council, the Nevada Rehab Council, any other councils that are on board. I just want to hear a motion that the SILC is in support of that.
This is Ace. So moved.
Do I hear a second?
This is Renee. I'll second that SILC works with other councils on the employment leadership. If I remember what Don said.
Okay. Are there any objections? Motion carries.
I think you need to ask if for those in favor.
Sorry. Those in favor?
Aye.
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 Aye, sorry.
Did everyone? Any objections? Okay. Motion carries.
Thank you. So if you don't mind, I'm going to move on to 15, where it's review and approval of Part B Program Progress Report to the Administration for Community Living. I've submitted the material. I know that you had probably enough time to review the important pieces. If you have questions about it, feel free to reach out to John or myself, because he and I are the contributors toward that document. But I am looking for a motion to approve that report with the latest one that was submitted to ACL on behalf of SILC before the deadline on January 31st.
Mary, are you raising your hand?
Yes, before we make that motion, may I speak, Julie, please?
Yeah.
All right. Let me see. Wendy, can you let me share the screen one more time?
You can just share it, Mary.
Oh, okay, here, and easier said than done, guys. We're trying to do something here.
Keep in mind, Mary, also that it's 3:53 and we only have the Carton interpreters until 4.
And we have
And
public.
I am keeping that in mind. I know this report has a tight deadline, Don. I have some concerns. And I'm just gonna, instead of popping up the screen where I highlighted the yellow. Okay, in a couple of sections in this report, under the challenges, it mentions that the SILC is struggling to support a Title VII Part B center in compliance. I've been on the SILC since 1991. I don't remember
Right.
voting in a Title VII Part B. in compliance.
Hang on.
So can one of our co-hosts please mute the person who is speaking? I can't see who that is. And Mary, you're sharing the wrong screen, I think. We're looking at your report from DAD.
Yeah, okay. Let's see. I just think this is too important an issue to rush through a vote. Let me where can I get my screen? Hold on, screen share. And I know we had such a wonderful meeting and such a wonderful presentation, a lot of data, but there's just some things in this report. Lisa, are you there? Okay.
Yes, I am.
Do you have that where we highlighted some of the sections on the PPR report that you could pop up on the screen?
Let me work on that. You talk and I will look.
Okay, and then I'm looking, let's see, where was it? Oh, I wished I was better at this, you guys, I apologize. But anyway, Dawn and John, okay, on the challenges, it's clearly mentioned that the SILC has a Title VII Part 3 in compliance center. That's not correct information. We do not. Then there was another section that it mentioned that the SILC has a Title VII Part B center in one of the objectives. So I guess, did we miss something? Who made?
Are you not able to share your screen? Because I would really like to see that section you're talking about, because I don't recall putting that in there, but if I did, it was an error of some kind.
Okay, that's what I thought, because I thought, wow. Okay, hold on, let me try this. I have to go to my emails inbox.
I might be able to help. I can't pull it up, but I've actually got the hard copy in front of me. It's on.
How about this? I'm looking for an approval for the PPR with changes to those sections that you brought up where there are errors regarding the Part B center. How's that?
Only if we get to make the changes, because there's a couple of other areas.
Yeah, because then behind the scenes after the meeting, you can show me and I can make those changes before I submit them.
Okay.
Does that sound good to everybody?
Lisa, does that sound good to you?
I'm concerned that we did not identify all of the errors and that we're agreeing to just the errors that we just discussed.
Exactly, because we highlighted several areas in there where there were errors. Let me try again to share my screen. And I'm sorry, I wish we had more.
We literally have 3 minutes.
Okay.
I don't know.
You'll just have to get with me afterwards. We technically don't need to approve the PPR as a SILC. We can just, make our changes and post it. So I'll get with you guys after the meeting before it's submitted so that we can fix it.
All right, but I don't want just Lisa and I showing you the changes. If Julie.
Well, what we can do is we can review what changes were made at the next meeting. How's that?
When is the next meeting?
In April?
Okay, because the PPR is due January 31st.
Yes, I know, but we'll get together and we'll get it sorted out before it's submitted so that it's to your satisfaction.
Okay.
And then, we'll just go over what was changed at the next meeting.
Okay, that would work because we have everything's highlighted. They're easy fixes. So, but I do want to say the data was good. A lot of the narrative was good. They're just.
I'm gonna have to cut you off.
Thank you, Julie, for your patience.
Thank you.
Okay, thanks for bringing that up, guys. I must have missed those. I'm sorry. So moving on to, I know we have 2 minutes and we still need public comment, but I need a motion to approve the executive director of the SILC to represent Nevada SILC on the Medical Care Advisory Commission I've had the opportunity to apply for that, and I think it would be a strong voice for the SILC for me to speak for them if you would so grant me that opportunity.
And we discussed this in executive session. And Amanda and I both thought it was a good idea. So is someone willing to make a motion?
I'll make a motion that Dawn be allowed to work with the medical commission and represent us there.
Do I hear a second?
This is
Yeah.
8, I'll second.
All in favor, real quick?
Yeah.
Aye.
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 I,
Okay. Any opposed? Motion carries.
Thank you. This is Dawn Lyons, and I recommend that we also just allow anybody to reach out if they have questions regarding the budget that was distributed or the spill information that was provided. I will send an email and to reiterate some of the things that were said at the last meeting regarding the next spill and ACL's instructions to extend our current one. Just so that everybody understands again. And then the last thing would be the public comment, but during public comment, as the first public comment, I would like to say we didn't have an agenda item for our next meeting date. And I would like to propose that we bump it up 1 week to April 5th and 6th due to some conflicts in scheduling for leadership. If everyone is on, if anyone has an issue with that, just reach out to me and we'll try to figure something else out. But as for now, I would like to just propose, throw it out there that we meet April 5th and 6th from 1 to 4 p.m. That's again Wednesday and Thursday. It's just the week before that's on our schedule, and I'll have Wendy send out the new revised schedule on that. So thank you.
Thank you. Any other public comment, quickly?
Julie, so Dawn and you and I and Lisa will meet afterwards for the changes in. PPR, is that correct? Thank you.
Absolutely.
I do appreciate both of you. Thank you.
Thank you for everybody for sticking with us. And especially the interpreters. We appreciate you more than you would ever know.
And Becky, our captioner. Thank you, Becky.
And Becky, our captioner, of course.
Thank you, everybody, for all your hard work you put in. We appreciate you.
Thank you. Meeting adjourned.